Good morning. Welcome to the third annual Summit on the Future of Rural Healthcare. We are here to strengthen and to share a commitment for healthcare for the millions of people who live in rural America. And it's a commitment to serving those that drives everything we do here at Sanford Health.
From innovations like virtual care and AI to panels on public policy and Veterans Affairs, the wide-ranging discussion at the third annual Summit for the Future of Rural Healthcare saw leaders from across the medical landscape tackling some of the most important issues facing hospitals today.
We've entered a new era with virtual care, and the technology is benefiting patients.
When people are face-to-face with their doctor in the healthcare system, they love that experience. They want virtual care to bring that same experience into their home in terms of cost, in terms of convenience, in terms of quality. It's got to be better than the core experience because we're asking people to do something that's different and new.
Being able to beam in specialty expertise or support the boots on the ground caregivers with virtual nurses are really important capabilities to build even in the hospital infrastructure.
Radiologists who use AI will replace radiologists who don't use AI. There's lots of ways we can sort of amplify and increase productivity and safety around radiologists without actually replacing them, but augmenting them.
And we have a mission and a mandate to serve every veteran who has defended our freedom, no matter where they live, and that includes rural and highly rural veterans. Really important programming like the Close to Me program that actually brings our chemotherapy infusion teams to clinics that are actually rurally located so they don't have to travel instead of 2 hours, 4, 5, 6 hours to get to one of our tertiary centers.
We are dealing with a finite workforce pool. 25% of nurses said that they were going to leave the profession in the next 5 years. Providers will artificially have to close their doors. They will not be able to admit or accept new residents in fear of violating that staffing mandate.
It is true, if you're looking for a piece of legislation to pass, it often takes years. You can have little wins. The public perception of hospitals is good. It's strong. It's 70% favorable.
This past March, you visited the White House along with your partner, Mark Cuban.
We were very focused at that meeting on PBM reform, so pharmacy benefit managers. They can at least double or triple the cost. Let's reform the payment processing piece of it, because surely that's the least value-add component of the healthcare system, and at the same time seems to have the highest margin. So if we can start there, we can move on to more substantive problems further down the road.
The escalating cost of prescription drugs is really just an incredible threat to the sustainability of our system.
Issues of advocacy controlled from Washington, D.C. or the state capitals interact with everything that we do as physicians. So what the AMA tries to do is work within our legislators to make sure that policies are passed that will help us take care of patients.
And the people who come to us in their time of need are trusting that everyone in this room has their best interest in mind. And I'm confident as I leave here today that that's a fact. That each and every one of you, you're still focusing on the center of that, which is the patient. Thanks so much for all that you do. Thank you.